Our fourth speaker is Andre Grace. He is Canada Research Chair in Sexual and Gender Minority Studies and full professor in the Department of Educational Psychology. His talk today draws from his SSHRC Insight grant and is titled Growing into Resilience. Andre.
Okay, good afternoon, everyone. For a number of years now, I have a research program that has focused on the notion of resilience in children and youth and young adults, and particularly those who are in vulnerable categories. So my research at the Institute focuses on sexual and gender minority youth. And what I've done, I've gone back to the late 70s and looked at the period since to develop a resilience typology to guide my research. And much of the early research that looks at vulnerable individuals and resilience focuses on stressors and risk-taking and sees individuals as problems. So I want to turn that around. I spend a lot of time with the new moves in resilience research focused on asset building and indicators of thriving, where I really believe that every youth can be an agent of change, an advocate in their own lives, and given the opportunity, they can thrive and help their peers. So that really influences the research I do. A big part of it is peer-to-peer mentoring. And I have an Institute for Sexual Minority Studies and Services where we bring in youth who are thriving. I learn as much as I can about why these youth do so well, and then I use that to develop programming to help youth who are still struggling, and I involve the youth who are thriving in the delivery of that program. At the end of the day, it's all about comprehensive health. And I was very fortunate to be asked by the Chief Public Health Officer's Reports Unit to be an external examiner for two historic reports in Canada. In 2011, the report on the state of public health in Canada for the first time focused on youth and young adults, 12 to 29-year-olds. So I was able to bring a focus on sexual and gender minority youth to this study. And then we followed that in 2012 with another report that looked at sex and gender for the first time and how they influence health. So this work, you can't engage in education without seeing that education and health are inextricably linked. Research is only as good as the degree that we can use it to advocate for others. So my research has value when I'm able to use it to advocate for children and youth. Some of the work that I'm currently doing right now, I'm conducting a case study looking at the standalone sexual and gender identity policy that Edmonton Public Schools has had in place since November 2011. It's hard to believe it's ready for its first 5-year review, so I'm engaged in that process. Importantly, for the last few nights and again tonight, I will be helping to facilitate the community consultations in Edmonton Catholic schools. We've done the east and west sectors of the city, and tonight we're going to the north sector. And they have developed a wonderful process to bring interest groups together to discuss what a standalone policy around sexual orientation and gender identity can look like in a Catholic school. This is important work. Edmonton Public School was the first public school board on the prairies to have a standalone policy. Edmonton Catholic Schools, and I get emotional, will be the first Catholic school district in Canada to have such a policy. And as someone who taught in Catholic schools for 15 years as a closeted gay man, I can tell you, you can understand why I get emotional. So I am delighted to be doing this work. On the fun side, we get to do wonderful programming like Camp Firefly, We started Camp Firefly in Edmonton in 2004. It expanded to Saskatchewan in 2009, where it alternates between Regina and Saskatoon. We started a camp in Calgary a few years ago, and tomorrow morning I'm off to Trent University in Peterborough, and we'll have the inaugural Camp Firefly Ontario in 2016. So these are examples of the work that I'm able to do. I whipped the slide through, but let me talk about the Firefly acronym, because that summarizes the camp. So Firefly with a Y is fostering youth resilience, energy, fun, leadership, yay. The slide that's before you now is my newest project. In 2014, I was approached by Public Health Agency of Canada to start a program here in Edmonton to address a spike in HIV and other STIs among 15 to 29-year-olds in this province. The age gender specific rates of newly diagnosed cases of HIV are alarmingly high in the province, and particularly high in Edmonton. The stats for Edmonton are the highest of the 5 regions that the ministry keeps stats on. So I thought about the program, delighted to have funding from Alberta Health and Wellness and the Public Health Agency of Canada through the Alberta Community HIV Program, or Fund, to run this program where we focus on physical, sexual, and mental health. And I firmly believe that we need always to look at the linkages between sexual health and mental health. And so in this work, I relied on what I was finding in the work I do with street-involved and homeless youth, particularly those that are involved in sex work. One of the things these youth tell me is that when they have disposable income, one of the things they will spend it on is cell phones and access to the internet. So I thought, that's the ticket. We need to develop a website that is arts-based, and we have. And if you go to our CHU website, you will see the products of youth art jams. We have kids who do sexual health ed for one another with guidance from sexual health educators. We use zines, which are electronic comics, and we teach youth to value their bodies. One of the things I learned is poor body self-image is linked to engaging in risky sexual practices. My newest project now, and I'm being assisted by the university, to develop an online Sex Ed 101 course that is basically going to be short 10-minute modules using a gaming format that kids will like, so that they can learn the basics around HIV, other STIs, and how to reduce harm in their lives. So I'll conclude as I started by saying, research is great, research linked to advocacy is even better. So thank you very much.